So snoring is not necessarily always harmless. It can actually mask a more sinister condition known as obstructive sleep apnea, which is frequently associated with troublesome snoring. In obstructive sleep apnea, you get heavy snoring, but you also get associated obstruction of your upper airways. So your bed partner or yourself may witness gasping or choking or pauses of breath when you sleep at night. And it will also be associated with daytime sleepiness. Untreated obstructive sleep apnea can increase the risk of quite serious health conditions and conditions such as strokes and heart attacks if left untreated. So it's certainly something that should be looked into seriously if you find that snoring is a troublesome symptom either for yourself or for your bed partner. Absolutely, a blocked nose can be caused by a range of different reasons other than allergies. One of the most common reasons for a blocked nose is a septal deviation. So the septum is the middle partition of your nose that is made of cartilage and bone that divides the right and left nostril. In patients who have experienced traumatic injury to the nose, or even sometimes they may be born with a deviated septum, you may still experience symptoms of nasal obstruction and nasal congestion, separate to allergies. So recurrent sore throats aren't normal. And if it is something that you're experiencing on a regular basis and it's impacting your quality of life, specialist opinion through an ENT specialist consultant would be advised. Absolutely. So sleep apnea can most certainly affect people who are slim and not overweight. In fact, about 20 to 30% of my patients that I see in my specialist snoring and sleep apnea clinic are not overweight. And the reason why these patients may experience symptoms of snoring and sleep apnea are for two reasons. Number one, they may have unfavorable anatomy of the nose and throat that is narrowing the airflow when they attempt to draw breath at night, and this can put them at risk of sleep apnea symptoms. The second is that the physiology of the body, where the tone of their muscles relax excessively, independent to their weight. And this can also be a reason why slim patients experience and have symptoms of obstructive sleep apnea. So sinus problems can manifest in a range of ways, including a blocked nose, feeling of pressure around the cheeks or the foreheads. You can experience nasal discharge either from the front of the nose or the back of the throat. And these symptoms can impact the quality of your life, the quality of your breathing, and can sometimes result in recurrent episodes of sinusitis where you feel unwell. If these are the symptoms that you're experiencing, then it is worthwhile seeking expert medical ENT specialist attention to consider medical or surgical treatment options for your sinusitis.